The hours between thing about trauma surgery is that you exist in the space between life and death, minutes, sometimes seconds, where your decisions determine which side someone ends up on, and no matter how many times you make the right call, you remember the ones where right wasn't enough. I learned that at 27 during my residency when we had a mass shooting at a shopping mall. 17 victims came through our doors in 40 minutes. We saved 14. Lost 3 on the table despite perfect technique, despite doing everything right. Because sometimes the damage is too extensive and time runs out. 5 years later, I'm an attending trauma surgeon at Hennepin County Medical Center. And I still think about those 3 every time I hear mass casualty incoming. My name is Dr. Elias Moore, born in St. Paul, 4th generation Minnesotan. The kind of family that understands winter and hockey and the specific stoicism that comes from living somewhere it hits -20. Went to med school at the U of M, stayed for residency. Became a trauma surgeon because emergency medicine felt too slow and I wanted to be the one making the calls when seconds mattered. Most days I make the right calls. Some days I remember the ones who died anyway and wonder if I'm actually good enough to do this job. This particular afternoon, February 2:47 p.m., -6 degrees. Outside but 72 in the trauma bay. I was reviewing CT scans when my pager went off with the code that makes every trauma surgeon's heart drop. Mass casualty alert. Multiple GSW. 88 minutes. I was moving before I consciously decided to move. Trauma Bay 1. Prep for mass casualty. I need all available surgeons, anesthesia, and nursing. This is not a drill. The next 8 minutes were controlled chaos, prepping operating rooms, organizing triage protocols, getting blood bank on standby. My team moved with the precision that comes from drilling for scenarios you hope never happen but know eventually will. The ambulances started arriving at minute 7. I was in the trauma bay when the first stretcher came through. 23-year-old male. Multiple gunshot wounds to chest and abdomen, GCSA. BP 70/40 and dropping. I didn't hear the rest. I was already assessing airway, breathing, circulation, the ABCs that determine who lives and who doesn't. This patient was circling the drain fast. Or one, now. Call anesthesia. We're crashing. I looked at my resident. You're with me. Let's move. We got him to the OR, cracked his chest, started the desperate work of repairing damage faster than he could bleed out. Behind me I could hear updates: more victims arriving, 3 more critical, 6 stable, 1 DOA. 40 minutes into surgery, my patient stabilized. We'd stopped the bleeding, repaired what we could, bought him a chance. I closed, sent him to ICU, scrubbed out. Went back to the trauma bay to find organized chaos, continuing surgeons working on multiple patients, residents managing the less critical, nursing coordinating the whole operation. My attending colleague caught me. Elias, we've got a situation. One of the victims is the shooter. He's stable but the police want him under guard. They also need medical clearance before they can interview. Can you handle that assessment, shooter? The word hit different than victim. What's his status? Single GSW to shoulder, through and through, no vascular damage. Physically he's stable. Mentally, she shrugged. That's above my pay grade. Police negotiator is outside waiting to coordinate. I found him in the waiting area, tall, maybe 6'1", athletic build. Wearing Minneapolis PD blues with a crisis negotiation unit patch on his sleeve. Blonde hair cut short, blue eyes that were assessing me the same way I assess trauma patients: quick, thorough, reading everything. Dr. Moore. I'm Detective Nate Kellerman, MPD Crisis Negotiation. I need to know when I can talk to your patient. His voice was calm, measured. The specific tone of someone trained to de-escalate situations through words alone. The shooter. I kept my voice neutral, but I'm not sure I succeeded. Yes. He barricaded himself after the shooting. We talked him into surrender, but I need to understand his mental state. Whether he's a continued threat, whether there are other weapons, whether anyone else is in danger. He met my eyes. I know this is complicated, but I need your help. The honesty in that, the acknowledgement that treating someone who just shot multiple people was complicated, it caught me off guard. He's physically stable. Shoulder wound, painful but not life-threatening. We've given him pain management. I paused. But detective, I can't tell you his mental state. I'm a surgeon, not a psychiatrist. I understand. But you can tell me if he's medically cleared for questioning. If he's alert, oriented, able to communicate coherently, he is. But he's also post-trauma and on pain medication. Anything he says might not be reliable. I'm trained to account for that. Nate's expression shifted. Dr. Moore, I've been negotiating with this individual for 3 hours before he surrendered. I talked him down from killing himself and potentially others. I need to finish that conversation to make sure no one else is at risk. Can you help me do that safely? The weight in his voice, the responsibility, the calculation of risks. I recognized it because I carried the same weight in different contexts. He's in room 347, under police guard. I'll accompany you to ensure medical safety. But detective, if I say we stop, we stop. Patient welfare is my responsibility. Agreed. He offered his hand. Thank you. We walked to the room together. Nate moved with careful confidence, every step deliberate. Someone who learned that how you approach a situation determines outcomes. The patient, the shooter, was awake, staring at the ceiling, one wrist cuffed to the bed rail. He looked young, maybe 25, with the specific emptiness in his eyes that comes from trauma or drugs or mental illness. Probably all three. Nate pulled a chair to the bedside, sat slowly, hands visible, posture open. Hey Marcus, it's Detective Kellerman. We talked on the phone earlier. Do you remember? The patient. Marcus looked at him. You're the one who said I didn't have to do this alone. That's right. And you made the right choice. You put down the weapon, you came out, you let us help you. Nate's voice was steady, warm, like they were having coffee instead of a post-shooting interview. I need to ask you some questions. Is that okay? What followed was 20 minutes of the most skillful interrogation I'd ever witnessed. Nate asked questions that sounded like conversation, validated feelings while extracting information, maintained absolute calm while determining that no additional threats existed, that no other weapons were hidden, that Marcus had acted alone. When we left the room, I was exhausted just from watching. Nate looked tired but focused. You're good at that, I said as we walked back to the surgical floor. It's the job. Crisis negotiation is about understanding what someone needs to hear to make good choices instead of destructive ones. He glanced at me. Not that different from trauma surgery, I'd guess. You're making life or death decisions under pressure too. Different kind of pressure. My patients are usually unconscious. He smiled, small but genuine. Fair point, Dr. Moore. Can I ask you something? How many victims came in today? 11 total. 1 DOA, 10 we're treating. 3 critical, 7 stable. Survival rate. Too early to know for certain. But if the 3 critical make it through the night, probably all 10. I met his eyes. Why? Because I spent 3 hours on the phone with Marcus trying to prevent exactly this. Trying to talk him into getting help instead of hurting people. And I failed. His voice was level but I heard the weight underneath. 10 people got shot because I couldn't find the right words fast enough. The guilt in that admission, the responsibility he was carrying, it hit too close to home. Detective, you got him to surrender. You prevented it from being worse. You probably saved lives by ending it without additional casualties. But I didn't prevent it. That's my job, prevent crisis, not manage aftermath. He ran a hand through his hair. Sorry, that's not professional. Long day. It's been a long day for everyone. I paused. But for what it's worth, those 10 victims survived the shooting because my team did good trauma work. They survived the standoff because you did good negotiation work. We're both part of the same system. We both did our jobs. Something shifted in his expression. Partnership. Exactly. He handed me a card. If any of the victims need follow-up crisis counseling or victim services, have them call me. It's part of our unit's protocols. We help coordinate care after critical incidents. I will. I looked at the card. Detective Nate Kellerman, Crisis Negotiation Unit, Direct Line. And Detective, you said it's been a long day. You should get some rest. So should you, Dr. Moore. Elias, I said. If we're coordinating patient care, might as well use first names. Nate. He smiled. Thanks for letting me talk to Marcus. You made a difficult situation manageable. You made it safe. That matters. We stood there in the hospital corridor, both of us exhausted, both carrying weight from the day. And something about the moment felt significant in a way I couldn't quite name. Then his radio cracked, and my pager went off simultaneously. And we both moved back into our respective roles, but I kept his card. 3 days later, I was finishing rounds when my phone rang with an unfamiliar number. Dr. Moore. Elias, it's Nate Kellerman. From the shooting incident. I wanted to follow up how are the victims doing. The fact that he'd called, that he cared enough to check on people he'd never met. It said something about who he was. All 10 are going to survive. 3 are still critical but improving. 7 are stable, 4 already discharged. I leaned against the nurse's station. Marcus is being transferred to psychiatric evaluation. Physical recovery is good. That's good news. Thank you. A pause. Elias, this is going to sound unprofessional, but I've been thinking about what you said. About partnership. About us both doing our jobs in the same system. And I wanted to ask, would you want to grab coffee sometime? I'd like to talk more about trauma response coordination. For professional development, my brain said this was interdepartmental networking. My chest said something else entirely. Yeah, I'd like that. We met at a coffee shop in Uptown on Saturday morning. Nate showed up in civilian clothes, jeans, a dark blue Henley, looking less intense without the crisis negotiator gear. When he smiled, actually smiled, relaxed and genuine, it changed his whole face. Trauma surgeon, he greeted, handing me a coffee. Black with a shot of espresso. I guessed based on your job requiring you to be alert for 30-hour shifts. I laughed. Accurate. How'd you actually know? I watched what you ordered while pretending to read the menu. He grinned. Crisis negotiators are professionally observant. Also, I got here early and asked the barista, detective and stalker. I prefer thorough researcher. He sat across from me. So, Dr. Elias Moore, trauma surgeon at 32. Born where? St. Paul, 4th generation Minnesotan. My family's been here since Minnesota was a territory. I studied him. Duluth originally. Moved to Minneapolis for college, stayed for the job. German-Swedish background, which in Minnesota means basically everyone. He wrapped his hands around his coffee. I got into crisis negotiation after I was patrol for 3 years, responded to a domestic violence situation that went bad. The victim died because we couldn't de-escalate fast enough. I became a negotiator so I'd have better tools next time. The honesty of that admission, the weight he'd been carrying made my chest tight. That's a heavy reason. So is yours. You mentioned a mass shooting during residency. 3 patients you lost. That's why you do trauma surgery, isn't it? To save the ones you couldn't save then? He'd been listening. Really listening. Yeah, it is. We talked for 3 hours. About trauma response and crisis negotiation, about the specific burden of making life or death decisions under pressure. About growing up in Minnesota, him playing hockey until a knee injury ended that dream, me doing swim team and hating the cold despite being 4th generation Minnesotan. About being queer in law enforcement versus medicine, him coming out at the academy and having a training officer who made sure he was protected. Me coming out in med school to classmates who mostly didn't care because surgeons are judged on outcomes, not orientation. Why crisis negotiation specifically? I asked. Most cops want SWAT or detective work. Because negotiation is how you solve problems without violence. It's how you turn potential tragedies into successful outcomes. When I can talk someone down from a ledge or out of a barricade, he searched for words. That's better than any rest. That's actually helping. But you can't save everyone, I said quietly. No, I can't. He met my eyes. Neither can you. But we try anyway, right? Because the alternative is giving up, and that's not acceptable. Partnership, I said. Exactly. When we walked out into Minneapolis, cold -15 with wind chill. The kind of February afternoon that reminds you why Minnesota has a reputation. Nate stopped on the sidewalk. Elias, can I ask you something personal? My heart kicked. Sure. Are you seeing anyone? No, work makes it complicated. Trauma surgery doesn't keep regular hours. I get called in at 3 a.m. for emergencies. I work 30-hour shifts and come home covered in blood. Most people don't understand why I do this. I understand. I get called to crisis situations at all hours. I spend 12 hours talking someone off a bridge. I come home emotionally exhausted from carrying everyone else's trauma. He stepped closer. My last relationship ended because he said I cared more about strangers in crisis than him. Did you? Yeah, I did. No hesitation. But I'm trying to find someone who gets that this work matters, but so does. He gestured between us. So does this. Whatever this is, this feels like something, I said carefully. It does. His hand found mine despite the cold. Want to figure out what? I kissed him there on a Minneapolis sidewalk in negative 15-degree weather, both of us in winter coats, his hand on my jaw through my glove, mine on his waist. He tasted like coffee and possibility, and when we pulled apart, we were both grinning despite the cold. That's a really good start. Nate murmured. Really good, I agreed. But here's what I didn't know then. Nate Kellerman wasn't just a crisis negotiator who was good at his job. He was the kind of person who took every call, who talked to every person in crisis like they were the most important case he'd ever handled, who carried the weight of everyone he couldn't save, and blamed himself for circumstances outside any negotiator's control. And I was about to spend the next 9 months learning exactly what that cost. The next 9 months were a study in building something real around impossible schedules and shared trauma. My surgery schedule was brutal scheduled operations, trauma call rotations, teaching residents, administrative meetings, 30-hour shifts followed by 12 hours off that never felt like enough rest. Nate's negotiation schedule was unpredictable. Crisis calls came at any hour. Some lasted 30 minutes, others lasted 20 hours. You never knew. We made it work. He came to the hospital on quiet nights, sat in the surgeon's lounge while I was on trauma call, content to just exist in the same space. I went to crisis negotiation trainings when invited. Watched him role-play scenarios with the calm expertise I recognized from real emergencies. We learned each other in pieces. Nate made incredible lefts from his grandmother's Norwegian recipe. I could identify internal injuries by physical exam before imaging confirmed them. He had a scar on his left forearm from a domestic violence call gone wrong during patrol. I had a collection of surgical atlases going back to medical school. He was meticulous about de-escalation techniques, practiced scenarios constantly, studied psychology and communication, nothing left to chance. I was the same with surgical techniques, obsessive about staying current on trauma protocols and new procedures. We fit together in ways that surprised me. To people who worked in life or death situations, who understood that sometimes you do everything right and people still die, who carried guilt for outcomes outside our control. You know what I thought the first time I saw you? Nate said one night, both of us in my apartment after I'd worked a 20-hour shift, that I looked exhausted. That too. He laughed. But also that you were the most focused person I'd ever seen in a hospital. The way you talked about your patients, the way you made decisions, the clarity even after mass casualty chaos. It was, he searched for words. It was really attractive. Extremely attractive. You thought I was attractive while I was covered in blood explaining gunshot trajectories. I'm excellent at recognizing competence in high-stress situations. He kissed my shoulder. Also yes, very attractive. Should probably examine why I find blood-covered surgeons appealing, but let's table that for therapy. I pulled him closer. You're pretty attractive yourself. The whole talking people out of killing themselves with perfect calm thing works for you. It's a very specific skill set. It's an incredibly important skill set. I turned to look at him. Nate, I really like this. Even with the chaos, I really like it too. He kissed me. You make the chaos manageable. We make it work, I corrected. But there were cracks I didn't see, fractures forming under the surface like ice on a frozen lake. Nate took every call, every crisis, every negotiation that came through MPD's system. He worked 60, 70-hour weeks during crisis surges and called it normal. Came home exhausted and wired, replayed negotiations in his head, carried every person he couldn't save. You need rest between calls, I said after finding him at 2 a.m. listening to recordings of old negotiations. I'm analyzing communication patterns, learning from past cases. You're not sleeping. You worked 70 hours this week. Crisis doesn't keep business hours. People need help when they need help. Other negotiators can take calls, not like I can. I have the most successful talk-down rate in the unit. If there's a difficult case, they need me. His hands were shaking slightly from exhaustion and caffeine. I can't say no when someone's life depends on finding the right words. I recognized the pattern because I'd lived it myself. Professionals who pushed past safe limits, insisting they were fine until they weren't. Nate, I said carefully, you can't save everyone. I have to try. And there it was. The weight he'd been carrying since that domestic violence call years ago. The breaking point came in late October. Nate had been working a hostage situation for 16 hours. Armed suspect, 2 hostages, demands that kept changing. I'd watched him work remotely through the news coverage, heard his voice on the police scanner, staying calm despite impossible circumstances. Hour 18. He talked the suspect into releasing 1 hostage. Hour 20. The second hostage released. Hour 22. Suspect surrendered peacefully. Perfect resolution. Textbook negotiation. Everyone alive. He came home at midnight, physically exhausted but wired with adrenaline. Collapsed on my couch fully clothed. I thought he'd sleep. He didn't. At 3 a.m., his phone rang. Another crisis call. Suicidal individual on I-35W bridge, threatening to jump. Rush hour approaching and they needed to resolve it quickly. I watched him answer. Watched his whole body tense despite exhaustion. I'll be there in 20 minutes. He started pulling on clothes. Nate, a bridge jumper. High visibility, time sensitive. They're requesting me specifically. You've been awake for 24 hours. I'm a negotiator. Being awake doesn't change my ability to talk. He was moving on autopilot, grabbing gear, checking equipment. Someone's about to die if I don't help. You're not physically safe to drive, then I'll have patrol transport me. He stopped, looked at me. Elias, I have to do this. I wanted to physically prevent him from leaving. But I understood duty, and I understood that when someone's on a bridge, saying no feels impossible. Be safe, I said instead. He kissed me quick and distracted. Always am. He was in single quotes T. The call came 3 hours later from MPD's crisis unit supervisor. Nate had successfully talked the individual off the bridge. 4 hours of negotiation. Perfect outcome. Person was safe and being transported for psychiatric evaluation. But during the negotiation, Nate had made an error. He promised the individual something outside his authority to promise a specific treatment program placement that wasn't actually available. The individual had come down from the bridge based on that promise. Department policy, mandatory review, fitness for duty evaluation, meeting with police psychologist and crisis unit command. I found him at his apartment, sitting on the floor staring at nothing. Hey, I said softly. Sitting beside him, I lied to him. His voice was hollow. I promised him a placement in a specific program because I thought it would save his life. But the program is full with a 6-week wait list. I promised something I couldn't deliver because I was so tired I couldn't think clearly about what resources were actually available. I took his hand. Did he come down from the bridge? Yes, he's safe. He's getting help. But he's getting help based on a promise I can't keep. And when he finds out, Nate's voice cracked. What if he tries again because I lied to him? What if he dies because I was too exhausted to negotiate honestly? What did command say? Mandatory 72-hour rest. Evaluation by department psychologist. If they determine I'm impaired, I could lose my negotiator certification. He finally looked at me. Elias, I've never made a mistake like that. Not in 7 years. I've talked down hundreds of people and never promised something I couldn't deliver. Until now. Because even you have limits. His eyes filled. But what if someone dies because I'm not there, and someone else helps them? MPD has other negotiators. You have a team and backup and rotation protocols. I shifted to face him. Nate, I love you. I've loved you since you walked into that hospital room and negotiated with Marcus like he was a person worth saving. But watching you destroy yourself trying to respond to every crisis is killing me. You have to stop. I don't know how, he whispered. Then let me help you learn. I pulled him closer. You told me once that we're part of the same system, that we both do important work. Same applies to your crisis unit. You're part of a team, not solely responsible for every negotiation. You have to trust your teammates and take care of yourself. Because if you burn out completely, you can't help anyone. What if I'm not good enough without pushing past my limits? Then you were never as good as you thought. But Nate, you are good enough. You're so good that command relies on you, that suspects ask for you specifically, that you have the highest success rate in the unit. But being good enough doesn't mean working yourself to death. It means knowing your limits and working sustainably so you can keep saving lives for years to come. He broke then. Quietly, face pressed to my shoulder, shaking with sobs he'd probably been holding since that domestic violence call years ago. I held him. Let him cry. Murmured the things I said to families in trauma waiting rooms. You did everything you could. This isn't your fault. You're not alone. When he finally pulled back, his eyes were red but clear. I'm scared, he admitted. If I step back, if I don't take every call, what if I become someone who stops caring? What if I lose the thing that makes me good at this? You won't. The thing that makes you good isn't working yourself to death. It's caring deeply and staying competent. You can do both, care deeply and take care of yourself. They're not mutually exclusive. I don't know how to do that. We'll figure it out. Together. I cupped his face. But Nate, you have to try. You have to follow mandatory rest protocols and let others take shifts and trust that the system works. Because if you burn out, you can't save anyone, including yourself, including us. He nodded slowly. Okay, I'll try. 11 months later, recovery isn't linear. Neither is learning sustainable work practices, or finding balance, or building a relationship with someone who's still learning. He doesn't have to save everyone, but we made it work. Nate returned to negotiation after psychological clearance, still exceptional at his job but with enforced rotation limits, with teammates sharing difficult calls, with a department psychologist who monitored for overwork, started therapy for first responder stress, actually used his days off for rest instead of analyzing old negotiations. I learned his patterns, the signs when he was taking on too much, the way his voice got tight when he felt responsible for outcomes outside his control. Learned how to support without enabling, how to remind him he was part of a system. He learned mine too, the way I got quiet after losing a patient, the guilt I carried from the shopping mall shooting. Learned how to pull me back when I was blaming myself for things I couldn't control, how to remind me that good medicine doesn't guarantee outcomes. We built something steady, something that flexed with trauma surges and crisis calls instead of breaking. One morning in December, snow falling outside, Minneapolis wrapped in winter quiet, I woke to find Nate at my window watching the city. You okay? I asked, wrapping arms around him from behind. Yeah. He leaned back into me. Just thinking about that first day, about how we met during the worst kind of crisis, about how we've been coordinating ever since my negotiations, your surgeries, both of us trying to save lives. He turned to look at me. Elias, I got asked to help develop a no-MPT program, peer support for crisis negotiators, sustainable work protocols, mental health resources. They want my input because of my experience. My chest felt full. That's incredible. It made me think about what you said, about being part of a system, about how good work requires self-care, not just endless sacrifice. He smiled. I want your input too. Medical perspective on first responder burnout, coordination between police and trauma teams. Make sure we're building something that actually helps people. Partnership. I said, always. He kissed me there by the window with snow falling and Minneapolis winter settling in and 11 months of learning each other behind us. Elias, I love you. I love that you understand crisis work, that you don't resent the calls or the hours, that you helped me learn I could be a good negotiator without sacrificing everything. I love you too. Since you walked into that hospital room and negotiated like every person deserves a chance, I held him tighter. You're allowed to love the work and take care of yourself. They're not mutually exclusive. Neither are we. He murmured. 11 months after meeting during a mass casualty incident, standing with a crisis negotiator who saved lives through words and learning how to save his life in return, I realized something. Some people spend their whole lives looking for someone who understands, someone who gets that the work matters, but so does coming home. Someone who knows what it means to carry weight and when it's time to share the load. I found that person in a hospital corridor after the worst kind of crisis. Then found him asking questions about trauma response because he cared about doing better. Then found him every day after learning how to build something real. That's not a bad story. That's not bad at all.